Hello, can everybody see me? I've just realized why it wasn't working. Trish, I can't speak to you on speakerphone and do this at the same time. So I had to, as soon as you hung up, the picture started working again. So hopefully everyone can hear me. And I will be able to see comments as we're, there you go. I'm going to put a little wave and hopefully you can see them coming through now. Perfect. Carol, you can't hear me. Just a second. Is that better? G'day, Julie. Is that better? Is that... I might just have to use my hand. Is that better? Can everyone hear me? Yeah, exactly. Carol, can you hear me? Okay. Perfect. All right, guys, welcome to this next episode of Facebook Live. Hi, Nerida, how are you? This is a session on surgery after massive weight loss or weight loss. G'day, Amber, how are you? I have a whole bunch of questions here that people have asked me that I'd like to answer as we go through. But to start off with, does anyone have any pressing questions that they want to ask straight away before I've got a list of questions that people have been sending through. You can PM them to Trish, or you can send them through to me directly here, and we can have a chat about that. Okay. All right. So I have to keep Trish. I have to keep my glasses on, otherwise I can't see much without them. But I'll make sure I look sort of down like this, or adjust the camera so that you're not. How's that? Oh, I've got a halo all of a sudden. That's a little bit better, and it's not reflecting as bad. All right. So I've got a question here. I'm just going to read it up, and then and we'll go from there. The question is that I've lost over 60 kilograms, and I'm planning to have a tummy tuck. I saw one plastic surgeon in Sydney and he wanted to do a circumferential body lift, but I'm not comfortable having that done. G'day, Susie. He said that I won't be able to get the best results. I don't expect to be perfect, but I think I'll be happy with a tummy tuck to start. My question is, can I have a tummy tuck and then later on down the track, if I find that it's not enough, I can have some more surgery, some more skin removed from the back? Now that's actually a really, really good question and something that we do get asked quite often. The short answer is yes, you can. At the end of the day, the operating that we are doing is for you, it's for the patient. And it's not about what the surgeon thinks is absolutely perfect, but it's what the patient is happy with and wants to live with and is happy with in terms of their look. So if you are particularly interested in, and you've lost a lot of weight, you've got a large amount of tissue in the front, and you may have tissue in the back as well from your significant weight loss, you may say, right, it may be cost prohibitive. It may be more surgery that you don't want to have. And you may have priorities in areas that you think these are the areas that I want to have removed first. And that may very well be the front of your body, your stomach, and then across to the side. Now, if you go and have that operation done, there is no reason why 6 months down the track, 1 year down the track, you can go in and finish the operation if you like, by doing the posterior aspect. Different parts of that operation give a result for different reasons. The whole operation is for body contouring. The whole operation is for removing the extra skin. But the front half of the operation, if you want to call it that, the tummy tuck or an extended tummy tuck, is mainly for the abdominal muscles, mainly for the abdominal extra skin, and the muscles, and going out to the side around the sort of love handle area. Other than that, the actual circumferential lift and then going across to the back, it lifts the lateral aspects, the outside aspects of your thigh, and it then lifts your bottom up and takes the extra skin from the back as well. So if your main concern is your tummy, and a little bit of the love handles, that side area. You can have that removed in one operation, and then down the track you can go in and have the back operation done when it suits you, if it suits you, if you want to have it done. Not everybody's going to want to do that, and yeah, in some people it might not be a perfect result. Sure, it might not be exactly the amount of tightening that you need, but for some people that's where they want to be. And that's what we're supposed to deliver, or that's what we're supposed to be happy to give to you. Because at the end of the day, you've got to be happy and you've got to be comfortable with the operation that we're doing for you. And you don't want to have a bigger operation if you're afraid of it, or for a variety of reasons, you're not quite ready to go to that extreme. G'day, Kelly. I think part of what I said sort of applies to you as well. You want to have a tummy tuck done, but you're scared. That's not an unusual emotion to have. It's not an unusual thing. It's a big operation. It's a significant operation to go down the path of. And I think there's a few things that I would like to point out. And probably one of the first things you want to think about is that the person that's going to do the operation for you, the person that you're going to feel comfortable with, that the person that's going to operate on you, this is someone that you need to feel comfortable with. And I think that's really important. A lot of the fear comes from not knowing. A lot of the fear comes from not knowing what you're going to expect, and how long the healing's going to be, how long the scar's going to be, and what actually it is involved for that period of time that you're having the tummy tuck. And I think the more you speak to people, the more you speak to your friends, the more you speak to your family, someone who might have had surgery, and forums like this, the more you speak to us and doctors who are here, g'day Sharon, to actually help you understand what a tummy tuck is, how long a recovery period a tummy tuck is, and maybe speak to some patients who've had it and see the results of a tummy tuck. That hopefully will give you reassurance that one, it's the right operation for you, and two, you've got the right surgeon for you. Let me just roll that down. Paula, you've asked a very important question, and that's how does a tummy tuck recovery compare to a C-section recovery? That's a very, very interesting and very common question that I get asked. I think that when you look at a C-section, now obviously I'm not a gynecologist, but having had a wife who's been through that, you tend to be bed-bound a lot more. You tend to have not allowed to move as much. And in one way, if you think about it, the cut is going through the skin, through the muscle, down and into the uterus. It's a pretty deep cut, and it's going through quite a large area. A tummy tuck operation really should be limited to the level of the muscle and the skin above it. So as an overall thing for my patients, when they compare the two, you'll be up and around that day of operating. You'll be up and around the next day and walking around, and you should be comfortable. That's not quite what happens with C-sections, as far as I understand. You know, there's more bed-bound period. There's less. There's a longer time where you can't drive a car. There's a longer period. They sort of want to stretch things out to about 4 to 6 weeks, and that was certainly our experience. Whereas with the tummy tuck, I would expect if you're having a standard tummy tuck, provided you've got a pillow and you can put it in front of your seatbelt, then at around day 10 or so after surgery, you should be driving without too many issues. And you certainly should be up and walking around, and you certainly should be very comfortable within the first 24, 36 hours after the operation. One of the things, Kelly, I wanted to talk to you about is when you have a tummy tuck and you get scared, sometimes it's easier to explain the operation in a way that you might not have thought about. And for me, when I'm explaining an abdominoplasty, a tummy tuck, I use an analogy of making a bed. I like using analogies because I think people can relate to it a little bit more, and you can understand what we're doing. And what I talk about when we're doing a tummy tuck is I want you to think about making a bed. Now, I got 2 kids, and I can tell you that when you tell them that you need to make their bed and there's a doona on the bed, all they do is they just ruffle the doona up and your bed's made. Now, any parent will know, you can pick it pretty quickly that the doona has not been made, right? So when you think about abdominoplasty, tummy tucks, what I want you to think about is that there are 2 single beds next to each other. And there's a bit of space between them. And in between that space is a lamp. All right? And over that whole thing is a doona. Now, as you all know, when you make a doona, you can't just fluff it up like my kids do. You've got to take it all the way down to the end of the bed, pull it up, make it really nice and tight, and then fold it. That's how you make a bed, I guess. Now, from an abdominoplasty point of view, those two single beds sitting next to each other are the two muscles in your tummy. And they're two sitting next to each other, but they've been spread out. They've been moved further apart, often as a result of pregnancy, often as a result of having a few children. And as we've gotten a little bit older, it's started to go wider and wider. So, most people have been in a hotel where they've taken two single beds and zipped it up together, and it's formed a double bed. I think most people are familiar with that concept. That's the first step, if you like, from an abdominoplasty point of view. We have those two muscles sitting far apart. We bring them together like you would bring two single beds together, and then we zip them down the middle with an internal corset, very much like the zip that they do in a hotel, turning those two single beds into one double bed. Now, over the top of that, or in the middle, is a lamp, and that lamp is your belly button. And what we do is when we take the doona and we take it to the end of the bed and we bring it all the way down. Now your breastbone is the end of the bed, so your skin comes all the way up to there. Then we pull it all the way down, just like you do to make the doona taut when you're actually making a bed. You then fold it, and that bit that you fold, that's the bit that you actually cut away in an abdominoplasty, and you make a new hole for the top of that lamp, and that's the new belly button. So the operation consists of three things: bringing the two single beds together to make a double bed, making a new hole for the new lamp, or for the same lamp but a new lampshade, and pulling the doona down and getting rid of the extra so that you've made a nice flat bed. Sometimes with that doona you might have to thin out that goose down, and that's where we use a little bit of liposuction to thin that doona out to help the contouring. But if you think of it that way, it gives you a pretty good idea of what you're expecting in a tummy tuck. G'day Amber, how are you? Any other questions? I've got another one coming up here. And the question is, I need arms, thighs, tummy, breast lift, and the back of where my bra sits. Can you tell me what order I should have it done in? I'm hoping I can get it done in 2 procedures. If anyone's out there who's thinking of this operation, or who's thinking of a large amount of operating following massive weight loss, one of the things that we like to talk to our patients about is the fact that this is not operations that you can all do in one hit. It's taken you a long time to lose the weight, and it's part of a journey, and at the end of the day, you want to get the best results over a period of time. So when we do this operation, we do it in stages. You can do a whole bunch in 12, 14 hours, sure. But do you want to be lying on a bed for 14 hours? Do you want a surgeon to be operating for 14 hours and be tired? And I always tell my patients, look, we do it sensibly, we do the right amount for you, but we do it in stages. Now, when we have those type of operating to be done, usually what we like to do is pick certain operations that work well together and do them together and then move on. So for example, with this particular situation, what I would do, and in most patients I saw today, what we talked about, is that we would do your tummy first, and that would either be your tummy tuck or a circumferential body lift. We would do that first, along with a procedure on your breast if you needed it. And often that procedure is a breast reduction or a breast lift. Now, a lot of women may need more volume. So the breast, I do the operation in 2 stages. I do the reduction or lift first, and then I add an implant to it down the track. The way to think about that is that you do your first operation for shape, you do your second operation for volume. And you need time between the two because there's too many spinning plates in between, and there's far more complication rates. So I would do the tummy first, and I would do the breast reduction component first as the first operation. Then as the scars of your breast heal and start to look closer to the rest of your skin color, that's when I would do your breast augmentation, and at that time I would do your arm. So we would do your arms and your breast augmentation in one operation, your entire tummy and back, and your breast lift in your first operation. And then if you've got thighs or legs to do, that's your third operation. The other bonus in doing this is that as you're going along, things stretch again, things will form scars, and some of the scars might not be pretty. But if we do it in stages, then the previous operation, we can improve on that a little bit in the second operation, so that by the time we come to the end of your journey, we've hopefully given you a much better result. G'day, Angel. How are you? Congratulations are in order, I hear. Now, Jeanette says, I don't want to lose weight. I'm healthy and happy with my body. Just want to do a tummy tuck. And any advice on this? Well, look, a tummy tuck is done for a variety of reasons. And some of the reasons are massive weight loss and you've got a whole bunch of skin, but there are some people who are happy with their weight, but they've got a contour issue. They've got a lot of skin still present. They've got a lot of skin that's hanging over, or you wear your jeans and you've got you've got sweating, you've got what we call intratrigo, which is sort of rashes around skin folds. You might have bulging between your muscles as a result of some herniation. All of these are reasons to have an abdominoplasty. In fact, we've shown with research recently that you can improve on things such as back pain and incontinence by doing an abdominoplasty in the right patient. Something that the government doesn't like to hear and doesn't like to actually give women the actual Medicare rebate item number. It's another point of contention, but I know that we've all been pretty upset about that. I think that when you've got an ideal weight, when you're at a weight that you're happy at and you're going to be like at that for, you've been there for at least 6 months, you need to reassess the quality of your skin. If your weight is pleasant, it's less than 100 kilos, but you've got extra skin and you don't want to lose weight and you're happy to stay stable at that, if you have these issues, if you have these stables, then you might be a candidate for an abdominoplasty, a tummy tuck, without needing to lose weight. So that's when you speak to your plastic surgeon, that's when you assess your abdomen, and that's when you look at where an abdominoplasty might suit you overall. Okay, at what point do you give a Fleur-de-lis rather than a tummy tuck and Mons, considering having had 4 children? The Fleur-de-lis abdominoplasty is actually a very, very interesting procedure. It is, for those who don't understand or don't know about it, normally a tummy tuck would give you a cut that goes straight across your sort of crease. What normally happens in a Fleur-de-lis, you've got that cut, but going straight up the midline, where your belly button is coming up, is a second cut. And the patients who need this, not everybody needs this, the patients who need this often are patients who've lost a lot of weight, and you have skin excess both in a horizontal dimension and a vertical dimension. So if you're in if you bend over and you can pinch it, as I can at the moment, you can pinch it down here, that's a horizontal excess. But if you do that and you can pinch that and you've got from your breastbone down to your sort of Mons area, there's another bulge and it's in an up and down direction, you might need a Fleur-de-lis to get rid of that. Not everybody needs it, and some patients may say, look, I'm going to see what I look like after you've done the standard tummy tuck, and I might come and take that down later. And in some patients, you may say, look, you're just not going to look good without doing this. So again, it's something that you have a conversation with your plastic surgeon, and they can show you where your skin excess is, and then that helps determine whether a Fleur-de-lis is necessary or not. If you have excess above the belly button K, that doesn't necessarily mean that you need a Fleur-de-lis. Remember when I talked about the doona, lifting the doona all the way up? It goes above the belly button. It goes all the way up to your breastbone. And when you pull it down, you're going to take all that excess down. So it's whether it's a horizontal excess or whether it's a vertical excess that makes more of a decision, not so much where that excess might be. Hope that helps. Kelly, tummy tuck, the cost of tummy tucks. Yes, of course, that's a very, very interesting question again, and it really boils down to why you're having a tummy tuck and what can be compensated for you, and whether you've got a public, whether you've got Medicare only, or whether you've got private health funds. Now, I'm sure being members of this forum, you'll all know that a few years ago, just over a year ago, the government took away what was the standard 30177 item code for an abdominoplasty. That's gone. So there are now specific reasons that you have to justify whether the patient needs an abdominoplasty, in order for you to qualify for an abdominoplasty. Now, how that is calculated, or how they look at that, is that if you've lost more than 5 BMI points, you then and you've lost it and kept it off for 6 months and it's stable, it's affecting your daily living, and you have issues with that apron. You have rashes, intratrigo, which is sweating and rashes, and they've tried maximum medical therapy and it hasn't been successful. Now, if you have those things, or if your GP is happy to describe and has treated you for those things, then you may still be eligible for an abdominoplasty. Not everybody is, but then you might still be eligible for the abdominoplasty code. Now, if that happens and you are privately insured, then that allows you to claim your hospital stay, depending on the tier of your cover, of course. So I don't know your level of cover, but it can help in terms of giving you a rebate from your hospital stay for part of your anesthetics, the cost of the operation, as well as the operating theatre fees. That can give you a saving of roughly $5,000, maybe a little bit more, making the surgeons your overall fees between $5,000, $6,000, $7,000 saving. And that determines then what the actual final fee is going to be. And for each individual, that's going to be different. When you look at someone who doesn't have any cover, anything at all, and is going to completely fund this operation by themselves, then usually the fees start from around $10,000 and they work their way up. Most surgeons will give you a complete breakdown to give you an idea of what the total fee is going to be. Sadie, hello, how are you? You've asked which arm lift is better, from elbow to arm lift, and how much is effective? The one with the scar under the armpit. Look, it's not a question of which arm lift is better. It's a question of which is the right armpit. I keep saying armpit. Which is the right arm lift for you? For some people, the excess tissue is purely just on this sort of aspect of your arm. If that's the case, then an arm lift from elbow to your armpit is all you need. But if the excess is from there to your armpit, but then there's more skin hanging off there that you need to actually contour into your chest wall, then you will extend that incision, kind of like a fish's tail, and then you will then need one that has both a cut in the armpit and a cut up and down the arm. So it's not a question of which one's better, it's a question of which one suits you the best, and you tailor that to each individual person. Lisa's asked, I have a large apron, but I haven't met my target yet. Is an apronectomy and then a tummy tuck an option? Lisa, that's a really... I haven't actually been asked that question to that extent. My advice has always been, when people have asked for an abdominoplasty for a tummy tuck, my advice has always been, get yourself to your goal weight, stay there, and then have the proper abdominoplasty. In some patients, that's very hard to do because you can't exercise, you can't do things while you've got this apron there. In which case, sure, take out the apronectomy, get yourself to your goal weight, and then go down the path of a formal abdominoplasty. You need to remember that an apronectomy is just cutting out an extra skin. Just a flap of skin gets cut and stitched together. There's really no operating into the tummy muscles. There's the belly button should be left alone. Occasionally, they will take the belly button as part of the operation. That's something we have to deal with down the track. But an apronectomy can be done. You'll have a scar, and in some circumstances, you can utilize that same scar, obviously, well, you will, to then build your abdominoplasty from that. Look, I have done that a couple of times. It's not the usual way. Most people would just lose where they needed to be and then have the tummy tuck as their operation. But in some circumstances where the apron is really, really big and problematic, and you can't have the abdominoplasty because of that, yeah, look, it might be the right thing to do, but it's something that you would actually, again, get your plastic surgeon to have a look at and have a reasonably sensible conversation with you so that you feel comfortable with that option. You need an arm lift, but you haven't met your goal. Your arms make me wear bigger clothes now and affect your mental state. Arm lifts are problematic, always. It is an operation where you are sacrificing contour for scar, and you need to be comfortable with that. I have yet to come across what I would call, in my judgment, a beautiful arm lift scar. There's some nice ones, but as far as scars are concerned, arm lift scars tend to be some that aren't as pretty as some of the other scars. And that really stems from the fact that the arm is a circular object. It's a barrel, and when you cut down one side, there's always pull from different sides, and that means that the scar might get pulled in left or right, or might get stretched. And that then means that your scar in an arm lift has the potential to stretch and has the potential to become less hidden from where it was originally done. So it's not unusual to have your arm lift redone. In fact, it's not unusual to have most of these operations refined as we go down the track, because the skin stretch that is associated with massive weight loss means that the collagen in the skin isn't of the best quality to begin with. It's like having a sock that's been stretched, and then what you've got is that sock you're trying to cut all the way back and make it into a smaller sock, but it's still made of that same stretchy material. It's going to stretch out a little bit more, it's going to stretch out a little bit earlier, and it might not twang back again. And so when we do body contouring surgery, when we do these large operations, it's with the understanding that there's more than likely chance that there will need to be some tweaking and sort of some revision down the track. So yes, you could do your arm revision, and then you could refine it later. The problem is that it might completely change the way your scar is. So my advice for your arm revision or for your arm surgery is the first surgery should be done when you're at your best weight. Now at that point, once you've done it, if you need revision, that's different. There's no point doing it and then going, I'm going to lose some more weight and then I'll get it fixed up again. That really doesn't sort of quite work, because it changes the field of play, and it might change the scar, might change the type of operation, your skin might hang differently, and that can make things more complicated. So get yourself to the goal weight, stay at your goal weight, and then do the operating, and then revise it if you need to, but do it in that order, and you'll get a much more satisfactory result at the end. Victoria, you asked me, what about scar placement with the tummy tuck? Is it possible for the scar to be as low as possible? Yes. The simple answer is yes. The scar is normally at, if Victoria, if you've had a cesarean, or if the ladies out there who've had a cesarean, that's approximately the height of where we put our tummy tuck scars these days, and we do tend to keep it pretty straight and down across there. I usually ask my patients to wear a small bikini or a small underwear that they would wear when they come into their operation, and I draw my scar behind that or hidden behind that, because if we can keep it hidden in something small that you would wear, then anything larger than that, it should be well hidden. So for the vast majority of patients, the scar is low, thin, and well hidden all the way around when it comes to abdominoplasties or tummy tucks. Lisa, good luck with that. You've got about 20 more kilos to go. You've done fantastically well. So keep plodding on, and maybe I'll get to see you once you've got the 20 kilograms done. Carol there has got some fantastic advice. Hi, Carol. Yes, you can use super, and you can certainly use your health funds as well. So maybe you guys can have a chat to Carol with PM Carol and talk to her about that. Paula, you've lost 55 kilograms. You ideally like to lose 5 or 7 more kilos, but you've been very stable at your weight, quite a few months now. Would a plastic surgeon be able to tell me approximately how many kilos of loose skin I have? You know, Paula, this is actually a very difficult question. Skin, surprisingly, weighs far less than you would like to give it credit to. I would love to say that I lost 8 kilos of skin here or there, but it never happens. No matter how large the amount of skin that I actually take, I often find myself completely flummoxed when I actually put it on the scales and see what it is, and it's almost always less than what you would anticipate. It's a hard one to do. Probably the easiest thing you can do is put that amount of tissue on a scale and see if you can actually get that separated from your body and to get an approximate idea, but it's not a measurement that's very easily done. Until it's actually off you and sitting on a scale, working out just how much excess skin you do is at best a guesstimate. Meg was wondering about the Mons area. You booked in for a body lift, and my surgeon has said the Mons will be lifted a little, but not much. That's true, and that's actually for most things. If you think about it, your Mons is here, the skin from the top comes down, the Mons is here. When you stitch it, you're initially bent like that. When you straighten out, that's going to pull up a little bit. So it's something that we do talk to our patients about, that you will get some elevation of the Mons, but that should settle over a little bit of time. If you have a lot of excess bulky tissue in the Mons, then some patients may suit what's called a Monsplasty. Now that's something that you need to talk about and discuss, because a Monsplasty is an operation which has good results, but it has its own risks. And the main risk is that of lymphedema or swelling. All the good lymphatic channels actually coming up through your legs and then start draining around your groin crease and around your Mons. And if not done properly, or even if done properly and you run into troubles, you can damage these lymphatics, and you can end up with bilateral, sort of both sides or one-sided swelling of your legs, or swelling of the Mons that becomes either permanent or very difficult to fix and may have a long-term effect. So while a Monsplasty can be done, it really needs to be considered very strongly, and on all the sort of risks need to be discussed with you. And while some of it will be elevated a little bit after this operation, I find that as things all settle down, depending of course on the extent that it's been elevated, but for the vast majority of patients, it'll settle back down to a nice location. Thank you, Steph, for your comments. That's fantastic. Lacey, you've asked for the cost of a rhinoplasty. Unfortunately, this is a weight loss thing, and I'm a breast and body expert. I spend most of my days doing breast and body surgery, focusing on weight loss and patients with weight loss, but I do a lot of that. I don't do a lot of face work, and I certainly don't do a lot of rhinoplasty. So I'm probably not the surgeon for you if you are looking for rhinoplasty surgery. I can certainly put you in touch, and I'm sure Trish can put you in touch with some surgeons who I'm very happy to say are better than me in doing nose job surgery. So I wouldn't presume to give you a cost, because it's not really an operation that I do very much. Victoria, you tend to keloid, so you're worried about that. Yeah, look, scarring is an issue with all of these operations. I have a couple of techniques that I've tried over the last 24 months or so, and that they're sort of stitching techniques that I specifically do that has improved my overall scarring results quite well. But at the same time, I usually tell my patients, look, if your scars do really well, that's blame me. If your scars do badly, blame your parents, because there's a genetic component to this as well. Things do stretch, things can keloid. If you have a tendency to do it, you might, but at the end of the day, you can only put everything up in the position that it needs to be. A plastic surgeon, any surgeon, including plastic surgeons, well, you're going to get a scar. You're always going to get a scar. Where plastic surgeons are good, they're good at hiding the scars, and they're good at stitching to make that scar look as fine as possible. But there are some things that are out of our control, and keloid is one of those. And if they do form, well, you're in the right hands to know how to treat it. But I must admit, in that abdomen area, keloids are not as common as, say, the sternum area, which is your breastbone area. You're very welcome, Sharon. I have a question here. Do you do liposuction as part of your surgeries when working with weight loss? The answer is yes. Liposuction is a significant component to these operations. There are some components that you can only do after having done a lot of liposuction. You know, when you're doing a thigh lift or when you're doing a back lift, you actually do a lot of liposuction to thin the skin. To take all the fat and really thin everything else. I don't want to gross anyone out, but what you actually do is you thin everything to such a degree that you can hold it and just sort of pull really hard, and that amount of tissue comes away. And if you can do that, it's actually a very nice technique, because it leaves the lymphatics and it leaves all that good sort of tissue behind and sucks all the bad tissue out. And that is a newer technique, and it certainly has a lower risk of lymphedema or swelling and problems. It tends to conserve more of the good tissue. So yes, liposuction is something we do in this, and is done quite often. Can the Mons be decreased in size, not just lifted? Mons hasn't decreased. Yes, it can. You can do, well, it's part of the Mons plasty. You can actually take away tissue. You can take a wedge, for example, from the middle and stitch it. You can reduce the size. You just need to be accepting of the scar, the shape, and you need to understand and have had a good discussion about the type of scarring and the potential side effects, or not side effects, the potential risks that you will get from this operation. And as long as you're comfortable with that risk profile and are willing to go down that path, then it can be done. But I know a lot of patients don't want to go down that path when they hear that they could have permanently swollen Mons and both lower legs following this surgery. No worries, Victoria. How long should I maintain my weight loss before considering skin removal? Roughly 6 months. Between 3 and 6 months is what we most say. What we would say. My conversation with my patients is very simple. If I operate on you, I am operating on the snapshot on that day. It's like having a static picture. That's who you are. That's what I'm going to operate on. At the end of that operation, I will give you the best possible result that I can deliver. After that, it's you. If you then go on and lose more weight and were in a process of losing weight or wanting to lose weight, you ruin my operation because things are starting to get loose and saggy. If you go on and gain a lot of weight, you ruin the operation again because things are now extended. So you want to be at a weight that you can achieve, you can maintain, and keep stable, plus or minus a few kilos here or there. I mean, we all fluctuate a few kilos, but you want to keep it relatively stable. And when you can do that, and when you are comfortable doing that, and for every patient that's a different number, that's when you start considering the surgery. You don't do it while you're continuing to lose weight, or you don't do it if you think that you're going to crash diet, get it to a certain level, get your operation, and you're going to be fantastic. Because if you've gone down a crash diet or a quick diet, you're going to end up putting that weight on, or putting some weight on, and the operation wouldn't have been worth it. And these operations, they take a lot of hours, they take a lot of time for you, there's a large recovery time, and you want to give it the best possible shot for yourself. You don't want to sort of do all this and then ruin it by, binge eating again, or just going back to eat and stretching everything out. There's an interesting question that's just popped up. As part of prepping for surgery, do you suggest any vitamins or nutritional supplements so that my body can be in the best possible condition to help? Look, I think that's a really important question. Most patients who have had significant weight loss, while you're healthy, you will realize that you've probably got a decrease in nutrients, decrease in albumin, decrease in things like B12 in your system. So most patients who've got a significant amount of weight loss have usually done it through some sort of external help, and that can be through a bariatric surgeon. And usually when you've got a bariatric surgeon, you've got a big strong support crew around you. Certainly I work at Sydney Institute of Obesity Surgery, so there's a good group of people that, nutritionists, dietitians that are involved in these patients. In that situation, you want to have a good protein count, so that will be checked beforehand, and you need to have a good overall vitamin and just a sort of a screening test to see if everything's around the normal numbers. Some of it might be a little bit low. We might be able to accept that. But if the numbers are low, and if protein and albumin in particular, which are your healing proteins, if you like, are low, then you'll often have patients, have doctors tell you to, improve on that. Iron levels, for example, get all that right, check your hemoglobin. All of that can change. And they'll drop to a degree after surgery, and they contribute to how well things heal. So yes, there are nutritionists, and there are certainly things that you can eat and drink to optimize yourself leading to surgery, and that can vary depending on what is your particular issue. I don't know if kale or quinoa or one of those things is in there. I can't really see that, but I do speak to my patients about that, and we have a bit of a giggle. But just standard stuff that most people know about is probably going to do the job. What do you think about these companies that only charge, say, $6,000 for implants? Nerida, we are nearly at 9 o'clock, and that's probably where I'll stop. Let me just say that you would probably have me talking till 9 tomorrow if you actually got me going on this topic. there is very little, in fact, there is nothing positive that I would say about that. Cheap is cheap for a reason. That's the first thing. Okay. And if Amber, my colleague, is here, I think Amber had one of the posts of the year, if you like, on Instagram. And if you look at that from Hunter Plastic Surgery, she said a fantastic comment, which, you know, I stand by. I don't do $6,000 implants. I fix $6,000 implants. And I think that kind of sums up the story. I hope that makes, it's not being silly, it's actually what unfortunately happens out there. Yes, Steph, I agree with you 100%. Angel, my first car cost less than $6,000 when I was a uni student. It only lasted a week. Right, guys, so if there's no further questions, we might call it a night. Is there anybody else who I didn't answer, or the writing went up very quickly, and I may have missed a question? Is there anything there that someone's got a pressing question about that they would like to ask? If not, thank you very much for listening in. If there are questions, please pass them on to Trish, who will forward them on to me, and I can always send you a message answering your questions for you. I don't mind doing that. Gets me away from putting the kids to bed tonight, so I don't mind doing that tonight. Otherwise, if you have considered this surgery, if you're thinking about this surgery, the only other piece of advice that I can give you is that please have this operation, or please see a FRACS, Fellowship of Royal Australian College of Surgeons, qualified plastic surgeon. There are other FRACS surgeons out there, and there are, of course, a whole bunch of other surgeons, or actually other doctors who call themselves surgeons, who aren't really qualified to do this operation. For this type of operating, these are big operations, these are operations that can have complications. It's very easy for things to go well, but if things don't go well, you want to be in the hands of someone who's seen it and knows how to fix it. And that, in my opinion, is going to be a FRACS qualified plastic surgeon. So please, when you're doing your research, make sure that you see the appropriate surgeon for this. Alright guys, thanks very much. Really lovely to catch up with everyone. As I said, I'm around, and if Trish wants to send me anything forwards, or if you want to catch up with me, I'll always be available. Thanks again, have a good night.